Hey, good morning, good afternoon, and good evening, everyone. Welcome. My name is Eddie Rajram, and I serve as the Communications and Advocacy Manager at Y Global. It is my pleasure to welcome you to today's webinar, which is on advancing youth priorities ahead of the 2026 high-level meeting on HIV/AIDS. And on behalf of Y Global, Youth Lead, and Youth Rise, we want to thank you for joining from across different regions and different time zones. As we move closer to the high-level meeting, this is the critical moment for all of us to make sure that all of our voices and experiences and priorities are reflected in the political declaration and in the commitments that will help shape the future of the HIV response. So today we will officially launch the youth statement, which I hope that some of you joining us today have signed onto, and also have a quick discussion on how young people can influence the high-level meeting at national, regional, and global levels. So we are delighted that we'll be joined by youth advocates, community leaders, civil society partners, UN colleagues, and allies from across the world. Please make sure you introduce yourself in the chat. Let us know your name, where you are from, where you're connecting. It will be great to hear your voices. And without further ado, let me introduce our first speaker. To welcome us and provide us an overview of today's webinar, I'm delighted to invite Ruby Lawler, the Executive Director of Youth Rise, which is an international network of young advocates for drug policy reform and youth-friendly health and harm reduction service. Ruby, the floor is yours.
Amazing. Thank you so much, Eddie, and thank you everyone for coming to today's webinar. We're really delighted to have you here. So as Eddie had already explained, this webinar is an opportunity for us to launch some of the results of an ongoing collaboration that our organizations have had. And it's part of this advocacy that we have ahead of the high level meeting, building on work that we did last year in regards to youth advocacy and making sure our priorities were included in the global AIDS strategy. We have built on that this year, and we will be launching today, as Eddie said, the youth statement, which is an updated version of the youth statement from last year, which was conducted with 2 global consultations. And we'll also be launching a youth advocacy, or taking you through a youth advocacy toolkit that will also help you with your advocacy at national, regional, and global levels. So this webinar is a very strategic opportunity for bringing together young people, community-led organizations, civil society partners, UNAIDS, and others to strengthen coordinated advocacy ahead of this high-level meeting. So on the agenda today, we have an explanation of the road to the 2026 high-level meeting on HIV/AIDS from ICA, who will be taking us through some reflections from the interactive multi-stakeholder hearing that happened in May and some key political moments that we need to be aware of ahead. We also will be launching, as has been said, officially the joint youth statement, and thank you to all who signed on, and some advocacy resources in the toolkit itself. We'll have some opportunities for a virtual sit down to talk through youth priorities and advocacy opportunities ahead of the 2026 high level meeting. And we want to hear from you as well on this. And then we'll finish with some closing remarks. So thank you all for coming here today. We really appreciate the efforts you're all making in your communities at regional, local, national levels, global levels, and doing your best to make sure that these needs and priorities are heard at global spaces. So we really hope that this webinar assists you with that today. Thank you. Back to you, Eddie.
Thank you, Ruby, for the remarks and for also highlighting the importance of youth advocacy as we approach the high-level meeting. I am also now pleased to welcome Clayton Zibio de Lima. I hope I got your name right this time. The Senior Advisor for Community and Key Populations at UNAIDS Global Center. Clayton is currently representing UNAIDS as one of the 3 co-chairs on the multi-stakeholder task force, which is supporting the preparations for the high-level meeting. Clayton, thank you for joining us. It's over to you.
Thank you. Good morning, good afternoon, good evening, everyone. I would like to start. Thank you, Y Plus Global, Youth Lead, and Youth Rise for organizing this webinar and for inviting UNAIDS to be part. More importantly, I want to thank you all for your leadership and engagement in the high-level meeting process, and to make sure that we have a meaningful and strong youth-led advocacy in the lead up until the high-level meeting that is happening now in 2 weeks from today. We know that youth leadership has been critical and has been shaping the HIV response since its beginning. And we also know how, especially the last 2 years, have been challenging for community-led organizations, including for youth-led organizations. The global HIV funding crisis, the pushback on rights, the shrinking civic space, it's really adding a lot of pressure on the work of youth-led organizations across the globe. And despite these challenges, young activists have continued to show up with energy, with innovation, and with commitment. And your leadership remains and is more important than ever in this context. I think, as Ruby said, I think your engagement with the high-level meeting, it didn't start this year. It really started with your strong contributions to shaping the global AIDS strategy. It helped making sure that we have strong commitments in the strategy related to youth engagement in decision-making process, related to support to youth-led service delivery, to social contracting mechanisms, and to flexible funding for youth-led organizations. And the Global AIDS Strategy, then it provided an important foundation for the development of the draft political declaration that is right now being negotiated by member states in New York. So throughout this entire process, since the Global AIDS Strategy and this year, when officially the process for the high-level meeting started, young people continue to play a critical role. We were very happy to see strong engagement. For example, when we launched the call for the multi-stakeholder task force for the high-level meeting, and we have even here with us many of our strong young activists that are together in the task force. So I would like to acknowledge the work that Jeremy, Priscilla, Kimberly, Charles, and others have been doing, and especially thanks to Priscilla for serving as one of the co-chairs for the task force. These last months have been very intense, and this is not about what is happening related to New York. We know that there is a lot of work that young activists have been doing also to influence their country partners, the governments. So UNAIDS would like to really appreciate your work that you have been doing to ensure that the lived realities, the challenges and the perspectives and the needs of young people remain visible and reflected throughout this process. The engagement continued, and it was also very strong during the multi-stakeholder hearing. I think Ika will talk about that. We had strong interventions from youth, and of course continued also during the advocacy week and through the ongoing advocacy that now we have with the political declaration negotiations. We have been hearing very strongly the call from young people for commitments on key populations, on harm reduction, on comprehensive sexuality education, on sexual and reproductive health and rights, human rights, and meaningful youth engagement. And these are all important priorities. So, and please continue doing this advocacy in this final sprint that we have now. And this advocacy is important both at global level with the missions in New York, but also especially with the capitals, with your country governments, with ministers of health, of foreign affairs. We are now in this particular moment of the negotiations of the political declaration and the launch of the youth statement today. And the advocacy tool really comes in an extremely timely and important moment. So congratulations for that. At the same time, I just wanted to remember that the high-level meeting and the adoption of the political declaration is not the finish line. The adoption of the declaration will be one step, but we will need continued engagement of communities and youth organizations for the implementation of those commitments and for the translation of those commitments at a global stage in national strategic plans. And we hope that the declaration will serve not only as a statement of the ambition for the AIDS response for the next 5 years, but also as an accountability tool that can be used by youth networks to engage with governments. Finally, to finalize, I would like just to reinforce UNAIDS' continued commitment with youth engagement and with youth leadership in all their diversity at global, regional, and country level. Thank you very much. Back to you, Eddie.
Thank you so much, Clayton, for those very, very important reflections, and also to reaffirm the value of meaningful youth engagement throughout the high-level meeting process, and also where UNAIDS stands in this process. And I think we can all agree as youth-led networks and youth-serving organizations, having that support from UNAIDS, it's very, very critical. It shows that you value us, you understand us, and you give us that space to raise our voice. So I do want to thank you for making the time to join us today. And you're right, this is not the finish line. This is only the beginning. It sets the precedent, right? So there is more work to be done, and the high-level meeting is not just the first stop. So yes, thank you so much, Clayton. Okay, so now to help us better understand where we are on that road, speaking of that road, we have Ika Novianti. Ika, who was there at the interactive multi-stakeholder hearing just recently in New York. Ika serves as the executive director of White Plus Global, and she was also one of the speakers there. So it'll be very interesting to hear how that unfolded and how that went. Ika, the floor is yours.
Thank you so much, Eddie. Hi, everyone. Good day. As Eddie mentioned, my name is Eka Novianti. I'm speaking on behalf of iPlus Global, where I serve as the executive director. As my colleague mentioned before, it is a pleasure to welcome you in this webinar, jointly organized by YPlus Global, Youth Lead, and also Youth Rise as part of our collective effort to advance youth priorities ahead of the 2026 high-level meeting on HIV/AIDS. I'm pleased to share a brief overview of the HLM process and also the multi-stakeholder hearing that I went on May, a reflection from the multi-stakeholder hearing held on May, and some of the key political moments and opportunities ahead for young people and youth-led network. So the 2026 high-level meeting on HIV/AIDS will be a critical political moment, as Clayton has been mentioned before, where member states come together at the United Nations to review the global progress on HIV commitments and negotiate a new political declaration that will shape the global HIV response for the coming years. So this process is not only about government. It is also an opportunity for communities, civil society, and particularly young people to influence priorities, language, accountability mechanism, and financing commitments that directly affect our life and future. One of the important milestones leading up to the HLM was the interactive multi-stakeholder. The hearing creates space for civil society, community-led organization, young people, researcher, and also the member state to exchange the perspective and identify the priorities for the political declaration. So from my reflection during the hearing, the several key themes strongly emerged. First one is there was a clear recognition that inequalities continue to drive the HIV epidemic. Young people, especially young people living with HIV and young key population, continue to face barriers related to stigma, criminalization, shrinking civic space, and limited access to youth-friendly services. The second one, there was strong emphasis on meaningful youth engagement, not tokenistic participation, but real partnership in decision-making space. Young people are not only beneficiary of the HIV programs. We are leaders, as we all know, advocates, service provider, and also accountability actors. And the third one is the financing and sustainability remain major concern. Many youth-led and community-led organizations are facing funding uncertainty, despite the playing a critical role in reaching underserved communities and advancing right-based response. Another important reflection was the need to protect human rights and evidence-based approach in challenging political environment. We are seeing increasing pushback globally against gender equality, sexual and reproductive health and rights, harm reduction, and the rights of key population. This may coordinate youth advocacy even more important ahead of the negotiation. So looking ahead, there are several key political moments where youth engagement will be essential. So we can do the ongoing, like involve in the ongoing consultation and negotiation on the political declaration itself, through the regional advocacy with or national advocacy with the member state and the regional blocks, mobilization ahead of the HLM itself, like what we are doing right now, and continue effort to ensure accountability after commitment are adopted. This is why the joint youth statement and the 2026 HLM Youth Advocacy Guide are so timely and important. They are helping us to articulate shared youth priorities while also providing a practical tools for advocacy at the national, regional, and the global level. So we encourage to all youth-led organization, network, and allies to use the joint youth statement as a tool to engage with your government and highlight our emerging priorities. It is only through collective advocacy that we can transform the political declaration on HIV to be right-based, adequately funded, and genuinely responds to the realities faced by young people. I think that's it from my end. I will get back to Eddie. Eddie, over to you. Thank you so much.
Thank you so much, Ika. And thank you for also being the voice for young people and representing us in New York. And I say that alongside with the other youth representatives, Jeremy and Kimberly, who we'll speak to in a second. Yeah, we are happy that you were able to kind of be there to speak up on our needs, highlight those emerging priorities, and being the voice for young people. So we really appreciate you giving us some of those reflections. Okay, now we have reached the key moment of today's webinar, which is the actual launch of the joint use statement. But before I introduce our speaker who will walk us through some of those key priorities, I would like to acknowledge one particular person, Andre Gomez, not here today, but they were able to play a very, very critical role in supporting us in the development of that statement, and also the other resources. But unfortunately, Andre was unable to join us today, but we are very, very happy that he was able to support us through this entire process. Now, it's my pleasure to introduce you to Gabriela Romero, the Senior Programs Officer at WebPlus Global. Gabriela will walk us through the statement, its key priorities and recommendations, and also how young people, youth-led organizations can use the resource to strengthen advocacy efforts ahead of the high-level meeting at all various levels. So this is the time. Gabriela, I will hand it to you.
Thank you. Thank you very much, Eddie. What an introduction. And thank you for sharing the screen so that we can all have a look on the statement. So like as Eddie said, I'm going to take a few minutes to walk you through the joint youth statement. And don't worry, I'm not going to read every single word. You can do that at home later when you have time. My idea, because I know like sometimes Zoom can become quite repetitive. So instead, I want to guide you through the main messages that we have developed in the statement and included in the statement. Why is it important and how we can use it in the work that we do. So starting here on the first page, the statement begins with a very important message, which is young people are not only beneficiaries of the HIV response, but we know that young people have been leaders, partners, peer educators, advocates, organizers, researchers, health service providers, so many different roles. So, and I think this is the real heart of the statement. It reminds governments and decision makers that young people are already shaping the HIV response, and very often in creative and powerful ways, like we're doing it right now. And sometimes we all know with very limited resources. So the statement then talks about the world we're living in right now. And we know that it's not an easy one. So it's just mainly like an introduction and providing context where we are. We know that we're seeing funding cuts, we're seeing youth-led and community-led organizations struggling to survive, shrinking civic spaces. And we're also seeing a lot of pushbacks against language on key populations, gender equality, human rights, harm reduction, and sexual and reproductive health and rights. So the statement is basically saying that is basically not the moment to become quieter, but this is important also for the young people. So because if young people and key populations are being pushed out of decision-making spaces, then we need to push back and also make sure that our priorities are visible. So now I'm going to move on to the next section that is already here, as you all can see, be bold. And I really like this section because I think this is exactly what we need from governments, and it's exactly where we're going into what we are expecting or what is the needs from the statement. So basically bold commitments. So the statement says that youth engagement has to go beyond tokenism, and this is very important. Meaningful engagement is different, and it means young people are involved from the beginning, listening to seriously, resourced properly, and included in decisions that affect their lives. So the statement presents then 6 priorities, and these are the main asks we want the governments and partners to take seriously for in the 2026 political declaration. As you can see here, the first priority is about addressing inequalities. This means that we're recognizing, or we want that they recognize that HIV is not only about access to medicine, even though medicine is very important, it is also about whether young people can stay in school, access information, and live free from violence, have economic opportunities, and receive support when they need it. So when we're talking about ending AIDS, we're also needed to talk about poverty, gender inequality, stigma, discrimination, etc. The second priority is about youth-centered health service. I realize I'm talking very fast, and I know we're having translators, so I'm going to try to slow down. This means that services that actually work for young people. We all know that we want services where young people don't feel judged, where they feel confidentiality not respected, not services where young people are treated like they are responsible or invisible. So we need services that are friendly, safe, accessible, and connected. This in mental health, harm reduction, testing, prevention, treatment, and many other things. And also the statement talks about innovation, right? We're talking about the need of including telehealth, self-testing, digital information, and new prevention options, like U equals U. But the key point is this one: innovation is only useful if young people can actually access it, which is also a very big ask that we have included. A new tool that is not only a solution, but it actually reaches people who have already money, internet, or safety, or can have access to all of this. Now on the next page, we can move to the next page. We're going to continue on the third priority, which is data and accountability. And I know this one might sound a little bit technical, but it's actually very, very easy. If young people are not counted properly, their needs are going to be ignored. So we need data to show what is happening to young people in all their diversity by age, sex, population, and community. And young people should not only be the subject of the data, we also want to see young people involved in the whole process, identifying gaps, asking institutions. So yeah, that's the third one. The fourth one is related to comprehensive sexuality education and harm reduction education. And it's basically knowing that information saves lives. So young people needs to have accurate, honest, age-appropriate, rights-based information without silence, shame, or fear. Comprehensive sexuality education and harm education are going to help young people to make informed decisions, protect themselves, and understand that their rights are being supported and that they can also support their peers. And of course, very important is to know that these programs should be designed with young people, not just for young people, because we all know that how language works, what platforms people use, what fears young people have. And the fifth priority is about ending punitive and discriminatory laws and policies. And I think this is one of the strongest parts of the statement, because we cannot say we want young people to access health services while also criminalizing who they are, who they love, and how they survive. The statement calls for governments to remove laws and policies that criminalize HIV status, sex work, drug use and possession, LGBTQI plus identities, and that restrict adolescents' access to HIV, sexual reproductive health and rights, TB, mental health, and harm reduction services. Yeah, we're almost there. And the sixth priority is about funding. And this is one that is very real for many of us in the webinar. We all know as youth-led organization that often it is expected to do a lot, mobilize communities, represent young people, provide peer support, attend meetings, reviews, documents, campaigns. But many of the organizations do this with very little funding, perhaps also sometimes even short-term funding or no core support at all. So the statement says clearly, if governments and donors believe in youth leadership, they need to fund it, not only in small project grants or a last-minute consultation fees, but really flexible, long-term, sustainable funding. And now we're almost moving to the last section, which is put us back on track. And that is hopefully the part of the statement that's the part of the statement that reminds us that the 2026 high-level meeting can help bring the HIV response back on track. But that will only happen if political commitments are there with the right-based, youth-centered, and backed by real funding. And I think I really like this part of the statement because we're pretty much reflecting on how decisions should be made with impacted groups and not only for them. So we want a political declaration that speaks from young people, that is developed by young people. And we want commitments that reflect the realities and lead to change in their communities. And finally, you can see here the supporting organizations at the very end. And I think this is very important because it shows that this is not just organizations speaking alone. This is truly a collective youth-led call. And we thank all the organizations that are part of this. Many of the organizations and networks have endorsed this statement, and together we're pretty much saying that young people must be recognized, resourced, protected, and meaningfully included in the HIV response. Before I close, I know, and I also want to mention that we have also developed an HLM Youth Advocacy Guide, which will be shared with participants in the coming days. The guide will help the HLM process easier to understand and support young people. Yeah. So our invitation is there, and thank you so much.
Oh, thank you so much, Gabriella, for walking us through the statement. You see, guys, we managed to get something down. I mean, it took a lot of coordination and a lot of effort. And I just want to remind people that it wasn't the fact that we just came down to six priorities. There were hundreds of things that we could have raised. But when we reviewed the zero draft, we recognized that there were six issues that meant the most to us between the networks that needed a little bit more visibility, a little bit more attention. So that's why we have those 6 priorities. That's why it's mentioned more specifically in our statement. And like Gabriella said, we're very happy that we got the endorsement from more than 50 organizations across the globe, which is absolutely fantastic. So we really do appreciate everybody who took the time to read the statement, to share the statement with your networks, and also to use that in your future advocacy when it comes to national or regional or global levels. Thank you, Gabriella, for walking us through the statement. And I'll just briefly mention that the statement is available on our website. It's also going to be available on YouthRise's website and YouthLead's website. We're going to promote it across all of our social media, so you'll have access to it. Anybody who's joining us on Zoom will also receive an email afterwards with the link to the statement and also any extended resources as well. Thank you, Gabriella, for joining. Okay, now we're moving on to the interactive part of the webinar. And Iris, who is our French interpreter, please do remind me to slow down as this part is going to get really fast. So if it does get too fast, just drop me a message and we'll try to slow it down for you. But before we get started, please let me introduce you to Jeremy and Kimberly. Jeremy and Kimberly are from 2 separate corners of the world. They are so far apart in space and time. One is in the evening, one is in the morning, but we're happy that both of them were able to join us. Jeremy is the regional coordinator of YouthLead and the NGO delegate representing Asia and the Pacific on the UNAIDS Program Coordinating Board. And also joining Jeremy is Kimberly Springer, the chair of the Y Plus Global Board and NGO delegate representing Latin America and the Caribbean on the UNAIDS Programming Board. So this is where it gets a little bit tricky because we're going to be doing Mentimeter at the same time and also chatting with Jeremy and Kimberly. So please bear with us as we try to navigate through that. But Tawanda, if you could please support us by sharing us the Menti QR code. We want anybody who's joining us right now to scan the QR code, connect with us, also share with us some of your thoughts and opinions. And as we wait for people to connect through the QR code or through going to menti.com, let me just quickly ask Jeremy and Kimberly a simple question. Yeah? Are you here, guys?
Yes, we are. Hi, Eddie.
Yes. Hi. So, could you let me know?
Eddie.
Hi, Kimberly. Glad to see you. Could you let us know what are some of the urgent priorities that young people want reflected in the 2026 political declaration on HIV/AIDS and why? Maybe I'll start with Kimberly first, and then I'll move on to Jeremy.
Thank you, Eddie. I think for me, coming from the small developing islands, I think some of the things that we want to see addressed in the political declaration more so revolves around the realities of living in the small developing islands, which is like the Caribbean islands and the Pacific islands. We are prone to natural disasters and we are prone to hurricanes and just earthquakes. Like a lot of these things that are happening, and a lot of the issues that we face it's unique. Yes, it's global. It can be global, but it's very unique. And those are some things that we want to see addressed, because when these natural disasters happen, a lot of young people would lose access to medication, lose access to going to clinics. So there's a lot of these things and a lot of these concerns. Also, the inequalities that we face in the small developing islands, especially for youth, with the lack of programming and the lack of support for us, because a lot of us, even though we are tiny islands, we are classed as middle or high income countries. But when you look at the realities of day-to-day lives and how young people, the lack of programming and the lack of just general support and employment and stuff for young people, all those things are affected and it plays a part. And then when you look at the context of how small our islands are, stigma and discrimination and isolation play a big part about it, because you can guarantee you could probably live on one end of the island, but somebody on the other end of the island may know you or may hear of you and may know of your status. And so all of these things are things that come into play. And if you look at the recent stigma index 2.0 that was done in the Caribbean, you would see how people are like, this nurse knows my family. I may not know this person, but this person knows me, or this. So it's a lot of those things come into play, and it's very much a priority for us in the small, and when it comes to the small developing islands. And also when you look at the young women and the young mothers that live in these islands, there's so much other factors and things that come into play when it comes to stockouts of medication, the lack of supplies, and just availability in a lot of things. So I think that is really, really important, and which ironically will fall into priority too with the youth statement. So yeah.
Thank you so much, Kimberly, and thank you for offering that perspective, because I think sometimes when we have these discussions, people representing archipelagos or regions with lots of islands, they just don't have that space or the forum to raise their voice. And Jeremy and I were both from the Asia Pacific, but we understand like the Pacific Islands are often, excluded from some of these conversations, yet they also bear the highest, HIV incidence. So it's very interesting to hear your perspective on that. So Jeremy, I mean, you can respond to what Kimberly's also saying, but offer your own opinions. What do you think?
Yeah, thanks, Eddie. Thanks, Kimberly. Maybe just to, continue from some of the things you guys already mentioned. I think one of the group also have often missed out from the conversation are the indigenous community. I think often a lot of the conversation did not actually address the challenges and the inequality that they are facing as well, in assessing to all those challenges. I mean, the question itself is what are the most urgent priority? So my quick response to it would be read the statement. I think the six priority that we have point out are the urgent priority, but just to maybe give a little bit more clarification in terms of what do those priority actually mean. I think Gabby just now also mentioned about, HIV innovation should be accessible by young people. So this actually referring to making sure that services are friendly, making sure that we have confidential care, making sure that the drop-in center, do not clash with the school or even with our work. And we want to make sure that, prevention tools such as like PrEP and also self-testing are accessible to young people, and young people know how to actually use them. So in a nutshell, it's really not to see HIV respond just through the lens of, the biomedical lens, but actually look into the other social determinant of health. Because we know that, when it comes to the exposure to HIV, it's not just about the risk factor. It is a lot of the other things that put young people at risk in the first place. And I think Ika sharing also just now make it so clear that because of the inequality, issues such as stigma, issues such as poverty, violence, mental health, which I'm seeing on the Mentimeter screen as well, SRHR, the fear of being pushed out of the school because of our identity as key population or LGBTIQ youth, having nowhere to live, because of poverty, and I want to draw your attention to one issues that I think all the region are facing, which is the repressive law and policy. I believe in many countries, young people are still facing the challenges to get access to treatment and testing because of the age of consent provision. And I think this is something that young people are calling the government, to repeal all those draconian law or those laws that restrict our bodily autonomy and our right to get access to treatment and medication. Yes, we know this innovation helps in the reduction of HIV cases, but if young people are not being able to assess it, regardless of which region you are from, we are in this vicious cycle of seeing more and more HIV cases among the young people. So I think to maybe wrap up is really to make sure that the reality of young people is really reflected in the political declaration. Yeah. Back to you, Eddie.
Thank you so much, Jeremy. And I completely resonate with some of the points that you've just mentioned, especially when you talked about human rights pushback. we've seen such a huge rise in the past few years alone of just the pushback on human rights. And everybody who's working within the space, living with or affected by HIV, we all understand that it is very interconnected to human rights. If there is pushback on human rights in countries, it scales back access to services, it increases the risk of violence, it reduces young people's needs and their need to go to services. It affects a lot of things. This is all about intersectionality. This is about how HIV is a cross-cutting issue. So, Tawanda, I'm going to kind of ask you to go to the second question, but as the second question comes up, Kimberly and Jeremy, I would also like to ask you the question, where do you see some of these biggest opportunities for youth-led organizations to help influence the high-level meeting? Now, Kimberly, I know you're on the islands. How are you doing it at that level? And Jeremy, how are you influencing it in Malaysia or in Bangkok? So I want to hear the two different contrasting sides on how we're able to influence a high-level meeting process through our engagement. So maybe actually I'll start with Jeremy first since I asked Kimberly first last time, and then Kimberly, you can respond after.
Sure. Thanks, Eddie. I think one quick, opportunity that we can all do is to work together across different issues, even across the border. HIV itself connects so much to all of us, although that contextual wise there are demographic differences or country differences, but we are all sharing the same, challenges and also the inequality, challenges in terms of sexual and reproductive health, challenges in terms of mental health, issues of education, issue of jobs. So we have so much commonalities that different countries, young people in different countries are actually facing. So if young people, the youth group can work on all these issues, together by maybe coming up with a shared demand for the declaration, I think that's a bit hard to ignore, isn't it? Because and the statement that we have just launch itself is something that I think we can all use in amplifying the advocacy messages. And that's what some of the young people in the Asian and Pacific are actually doing, which is to use the statement that we have released to communicate with their own national country team, talking to the UN agency. They can be UNAIDS or even some other UN organization, but also reaching out to policymakers, let it be from the Ministry of Health or the Ministry of Foreign Affairs, to really let them know, what does the political declaration actually means, to young people. And I think another opportunity that we can definitely use is the social media. Honestly, young people are already using, platform like TikTok, Instagram, Twitter to talk about HIV every single day. So I think what we can do, as the youth community is that we can share our experience, we can correct, misinformation and calling out what is actually not working within, the draft of the political declaration. And that is not separate from advocacy. I think that itself is advocacy. And if all of us, can coordinate, voices around, a similar or same messages using, maybe some hashtag together, decision maker do notice because they do read what is actually trending. They might not reply individually to us. And when they see something like that being shared thousands of times, they are aware and alert of that. And who knows that they might use what we have, advocate for using social media in their negotiation with other member states during the negotiation processes. So I think these are the two quick opportunity I really think is useful, for youth across a different region or even across the globe to really engage in throughout the high level meeting. Yeah. Back to you, Eddie.
Thank you so much, Jeremy. I couldn't agree more. The power of social media, hey, and the influence that has on people. Kimberly, do you think those recommendations resonate with you as well within the within the Caribbean?
Yeah, and I definitely want to agree with a lot of the things that Jeremy would have said. And also, in the context of us in the smaller islands, I always say that we have to keep our NAC managers and people in the Ministry of Health that we know these connections close, and also always communicate with them So anything that is happening throughout this process, I have been in communication with the technical director for the NAC for Trinidad and Tobago, the HIV helpline coordinator. So just getting what people on the ground are feeling and where their mind is at, and also using that to help from where I sit in a unique place where I have the opportunity to to be at the ear of these people, and like when we do to the missions and the member states. And this is something that I said recently in a regional meeting, where I told other young people who were attending that may come from they have different agendas or like different communities, like the climate change. And I said, now it's time for you all to show your support for young people living with HIV and the HIV community. So if you'll see someone post something, reshare it. Again, the power of social media. Like, now this is the time where you all get to show your support for young people living with HIV. And because these are your peers, these might be your friends, your family, who sit and suffer alone in silence. And now you have the opportunity to push this document, share, because you never know who is going to see, who is going to read it. And politicians these days are very much aware of what is happening on social media. They may not comment on everything, but they are very much aware of what is trending. So I think that is also very important. And I think always speaking about an issue and saying what the issue is or giving your input. If you find an email for the multi-stakeholder task force, and you were like, hey, I think you all should have a look at this, or you all should suggest this, send that email. Like, don't be afraid. Like, there's a lot of us who are in this space who would have the opportunity to speak to these people and who could influence what is happening. So don't be afraid to like say, hey, this is what I think should be amended, or this is what I think should be fixed, and this is my evidence. And send us these emails. Don't be afraid not to. Don't think, oh, this no one's gonna hear me out or care to what I have to say. But no, like, send it, because all of these things are gonna help, and it's going to affect and be part of the bigger picture. Yeah.
Yeah, thank you so much, Kimberly. And I couldn't agree more. I think when it comes to advocacy, the way that we work at national, regional, or global levels it's uniquely different, but it's also that we need to leverage our connections. It's understanding who we need to speak to be able to get our points across. And for the young people and the youth-led organizations joining us today, you can already see who's involved here. So leverage the connections that you have through this webinar to get your points across and to make those connections. I will open up the floor for maybe 5 minutes for maybe a couple of people who might want to share some of the reflections. I know that people are using the Mentimeter to provide some of the recommendations and some of the immediate concerns. But is there anybody here on the webinar who would like to share something very quickly? And I'll happily open up the floor to the space, to the public. People are very shy these days. Anybody? Okay, well, I will take the silence as everyone is probably using the Mentimeter or vocalizing it in other ways. But Kimberly and Jeremy, let me just quickly wrap up with one final question for you both. You don't have to take too long about that, but the high-level meeting is in 2 weeks. That's in 2 weeks. Is it? 22nd. Okay. What do we need to do now? What are our next steps? What are the immediate things that we need to do? So for you, what would that be? So maybe Kimberly, I'll ask you first, then Jeremy after.
I would say, looking at the political declaration, the draft, and the 2 point draft has come out a couple of days ago. So my thing is, read it, see what suggestions you or inputs you have that you want to be made. And again, like, go back to say, use the people who you have in this webinar here who are in these spaces. I know I'm always responsive. Jeremy is there, Priscilla, I think, and we work together. So I want the young people to know that when things are happening, we are in our little group chat talking to each other and being like, okay, do we want this? Are we going to go with this? Are we going to vote for this as a collective? Or like, what inputs do we think, or where do we think young people should fit in? And I think it's really important. I know it may be a lot of reading and, with TikTok and people's low attention span and stuff these days, but I think reading the draft and saying, hey, this is what I think is missing, especially as it pertains to young people and key populations, and reach out to us, be like, hey, this is what I think is missing. This is what I think should be added. And I know us as young people, we always have evidence for everything. So now this is the time where we put those social skills that we have and get the evidence, send the evidence to whatever it is you're suggesting to the draft and send it to us, and we will try as best on our end as we can advocate for whatever it is. Also, if you have influence in your countries where to meet the foreign affairs ministers and ministries of health, and you can have these people here, you can get messages across to these people. Do it, because now it's the time to push, because in the long run it's going to affect us as young people. Like, we have so much more life to live and so much more to give, so a lot of these things are going to affect all of us, not just some of us, but all of us. So I think it's really, really important. Like, now is the time to give your input. And yeah.
Couldn't agree more, Kimberly. Thank you so much. Jeremy?
Yeah, I'm just gonna make my response quick. I think this document, sometimes there are so many documents available and around, and sometimes this document could be very technical and complex. So my advice to young people who are watching this, or who might have a chance to stumble upon our webinar today, is that find one sentence in the statement that we just launched which you align the most, just one sentence, and then draft an email and send it to your country official. You might not know them, because we know reaching out to politicians might be very difficult, but you can easily find their emails in the government website. Sometimes you can, sometimes you can't. But if you do have the chance to do so, just copy that sentences and send it over to them through the government website. Send it to someone in the Ministry of Health, send it to someone who are from the Ministry of Foreign Affairs, because these are the two ministries who are most likely attending the high-level meeting representing your country, and send it to UN mission in your country, like UNAIDS office, and tell them why that sentence means so much to you as an individual or to your community, because you never know that they might read your email, and like I mentioned, use it as a reference for important conversation during the high-level meeting. So I'm just gonna stop there, and back to you, Eddie.
Thank you so much, Jeremy. I think that's a very, very solid, practical advice. Just find that one sentence in the statement that resonates with you the most and use that. Copy, paste, we know how to do that very effectively. And we know how to write emails. So thank you so much, Jeremy and Kimberly, for joining us and for giving that kind of regional and national context as well. Okay, we reached towards the end of the webinar. I'm not sure if Ruby is still around. I can see you. Yes. Okay, great. If you would like to just quickly summarize some of the discussions that we had, so maybe some of the things that you've picked out. Yeah, thank you so much, Ruby.
Thanks, Eddie. I've loved listening to everything in the webinar, and I'm going to really try. I took down keynotes of things that were said, but it ended up getting very long because a lot of it was so important. Basically, overall, the primary takeaway for me is that youth are active, ready, and engaged, and we're a powerful force, an important force in the fight against HIV/AIDS, and will not be silenced during these critical times of funding cuts, shrinking civic space, pushback on human rights, gender equality. So picking up more specifically on what some of the speakers said, we had Clayton reminding us that young people continue to play a critical role. For example, with many young people applying to be part of the multi-stakeholder task force for the high-level meeting, and therefore also resulting in a number of young people here on the call today as well, ending up on this task force and doing incredible advocacy on our behalf there, and making sure we were informed of the processes as they went on and continue to go on. Also reminded that the high-level meeting is not the finish line. The adoption of the declaration itself will be one step, but we will all need to continue to advocate for the implementation of these global commitments in national strategic plans, and that the political declaration itself will be a key accountability tool. Ika reminded us about the reflections, or gave us reflections herself from the multi-stakeholder hearing in New York, focusing on the main messages that were brought by civil society and key stakeholders during the multi-stakeholder hearing, particularly emphasis on the amount of civil society organizations and young people stating that there needs to be pushback against the human rights and gender equality, the pushback on that. Also ensuring that things like harm reduction, sexual reproductive health rights, and youth-led advocacy that are currently at risk are highlighted throughout the political declaration as key and must be pushed back on if there's any attempts to remove such language. Gabriella took us through the youth statement, which again, I'm also not going to repeat it all, but please do give it a read, and highlighted the 6 priorities that we have in the statement. And then Kimberly and Jeremy gave fantastic discussion towards the end there. Kimberly was focusing focused on the unique situations that happen within the islands and small islands, particularly around also the impact that intersecting issues such as natural disasters can have on young people's access to healthcare, HIV treatment, prevention treatment, and testing services, also the inequalities that exist in programming, especially for young people, and the role that stigma discrimination can play in such small islands. Jeremy was talking about the need for friendly services, confidential care, drop-in centers, not, making sure that they're done in a way that's like not clashing with school and work times, and making sure that we're not just taking a biomedical lens when looking at the aspects or the things that impact access to health and ending HIV/AIDS for young people, but also those socioeconomic aspects. And then they both provided some fantastic ways forward and things that we should focus on. Kimberly talking about leveraging our connections with allies in intersecting or parallel advocacy movements such as environmental movements, asking them to show their support for young people living with HIV and young key populations. And they both emphasized about the real importance of using social media, using hashtags, making sure that you're putting out your messages as much as you can and as clearly as you can. And in regards to making sure your messages are heard, really key to that is then making sure that the people engaged in the political declaration processes are hearing, or those closest to it that you can access. So in the advocacy toolkit that we'll share, there's more detail about how to contact, or maybe pointing you in the direction of national stakeholders that you could be in contact with, possibly to have the priorities heard. But like Jeremy was saying, also just Googling your government's website, trying to find contacts for someone in the Ministry of Health or Ministry of Foreign Affairs, looking through that youth statement. And if you can identify, like Jeremy said, with one particular sentence, doing that copy and paste that we know so well, and trying to make sure that the national representatives are making sure your priorities are heard in these processes. So I hope I wrapped it up clearly. Thank you so much.
Perfectly. I do hope that wasn't too fast for Iris. I'm so sorry. Thank you so much, Ruby, for neatly summarizing the main points from the entire webinar. I do want to thank everybody who joined us today. Just a reminder, everybody will get a copy or a link to a copy of the statement. The one-pager will be designed and shared very shortly alongside the high-level meeting youth advocacy guide. So these materials will be made accessible to anybody who registered through our Zoom. It will also be shared on our social media, so just keep an eye out. They'll also be available in different languages, so just give us a few more days to kind of fine-tune that. So it'll be available in French and in Spanish. Okay, thank you everybody for making time and joining us today. We really appreciate the ongoing support and efforts. You have our emails. Reach out to us if you have any questions. We're more than happy to provide the support and guidance at whatever levels. But yeah, we do appreciate the continued also support from UNAIDS, our colleagues there, throughout this entire process. The next 2 weeks is going to be a very mad one, so just try to stay sane throughout the entire process is probably the advice I'd give to people. Try to take those mental health breaks and self-care checks as well. So thank you everybody for joining us. Have a wonderful rest of the day. And if it's the end of the day, have a wonderful sleep. And we'll hope to see you very, very soon. Thank you so much, everybody.
Thank you, everyone. Bye-bye.
Thank you.
Bye.
Thank you. Bye-bye.
Bye-bye.